Hey guys, hey, how you guys are doing? Yes, you guys are in because it's quiet around here. I'm still kicking, and that's all that matters, I suppose. So yesterday I went and saw a new PCM, and I was supposed to see my old PCM, but he wasn't there. So let's just say, I told you guys before, like I think with my other video, I was pretty blatant about it. So TMI, if nobody wants to hear TMI, which I don't know you'd be on my channel if you didn't, because I'm always TMI. But so I'm having issues with my downstairs in the description box area. That's gonna keep doing that. Jesus, people, go on, because I'm on my phone. So anywho, so I'm having issues in the description box area, as we've talked about before. And it's only gotten worse because I told you guys I have diarrhea all day, every day. I have not had a solid BM since December. So that causes issues with being raw, you know, inflamed and stuff like that. And I also have something called an anal fissure. Yes, I said anal. It is kind of a tear in the folds, and so it doesn't really heal correctly. It's just like a tear, like a, you know what I'm saying, like you cut, like a big cut, but it's inside the folds of like your sphincter, or actually it could be in other places too, but where mine happens to be. TMI, again, I warned you. I don't know what else. I don't know if I should have like a red flag, like talk about my ass, guys. We're talking about my ass. So, but anyway, so I have to go see this guy, and my normal guy's really old and like, you know, just adorable, and so I'm like, whatever, you know, whatever. So I legitimately roll out of bed, put on some clean clothes, I brush my fucking hair, and then I leave. I look like hot damn it. Hot damn it. So I get there, you know, they're checking me in, and my blood pressure is really low. It's in the 90s, and the bottom part was in the 60s. So my heart rate was also dipping into the 50s, and, you know, they're like, that ain't good. But, you know, I felt okay. You know, I felt pretty normal for me. Like, I felt just kind of shitty, like I have the past couple of months, where I'm just exhausted and just kind of meh. But having said that, you know, I'll go back, wait. So, you know, they take my vitals and everything, and then I go sit and wait for the doctor. Well, I don't hear my doctor's voice because, like I said, he's an older gentleman, so I hear somebody else, and I think it's a tech or whatever's going to come in there and do something else. And here walks in this hot, so hot doctor, like just, and if it wasn't bad enough that he was attractive, the subject matter I'm going to have to discuss with him, and then also the fact that he had a very thick Russian or Ukrainian accent that was absolutely gorgeous. So not only am I mortified that I'm going to have to explain to this person that I have issues with my poop chute, but I also get him who's going to want to see it. So I was like, you know what? I will be right back. I have to, just a moment. I'll be right back. Because he was like, so I'm gonna leave a gown here, and you know, if you could get undressed from the waist below, and you know, just get in here and da da da. And I was like, you know what? Just why don't you just, I gotta pee real quick. Just hold on. And of course, I go in there and wash my hind end again. Like, you know what I'm saying? It was ridiculous, because if it would have been my old regular PCM, I'd be like, you know, I wiped before I left, you know, not that I, you know what I'm saying, like, I washed my hind end before I left, but because he was attractive, I had to go wash my hind end a second time. And I was like, oh no. no, please, God, please, no. Please, please, Lord, no. So, of course, he has to see it. There's nothing as humiliating that I can think of than having my ass in the air with all of my extra meats just hanging down while some guy's probing my butthole. Like, I can't really think of anything else that's nearly as mortifying as some stranger probing at your butthole, and you're like, yeah, about that. I just want to leave. So anyway, he gets done. He explains to me, I have hemorrhoids, and I have, a lot of inflammation, and I've got the anal fissure. So the anal fissure, like I said, is a big cut in it where mine is, and like every time you have to go to the bathroom, your sphincter opens, and then, it opens that cut. It doesn't allow it to heal correctly. So it does that a lot. It breaks open a lot. And it's very, very horrifically god-awful painful. Like, he gave me my prescription for the lidocaine gel. He gave me 120 milligrams of it. He's like, I know. Like, he's like, I understand the kind of pain you have to deal with. So he gave me a whole bag full of them. He's like, here. I get it. I'm sorry. Because the only thing you can really do for that is surgery. And the recovery for that surgery would be worse than what I'm already dealing with. So the best thing I could do is try to make myself comfortable and try to make myself, take extra precautions or whatever. So he gave me some hydrocortisone cream for your booty. He gave me all of those, and then he gave me some Imodium. Now, I don't think I should take that right now. He's like, if there's a really particular horrible day and you need a break for a day or so, you can use Imodium, but I'm not real sure how that would work until I talk to my distal bypass doctor. So also, like I said, my heart rate, my blood pressure, and then my sugar bottomed out. So what little amount of white, of pink that I do have to my face decided to leave. And he's sitting there talking to me about what he's talking about, and like he looks at me and he's like, "You don't look so good." And I was like, "Yeah, I'm feeling crappy today." He's like, "Is it your vitamins?" And I'm like, "Yeah, probably just feeling really crappy because I was gonna have some labs done, so I couldn't." I was fasting. So he's like, "You know what? Since you're deficient in some of these, I want to check other stuff. I want to check your parathyroid. I want to check your progesterone, your estrogen, your testosterone." He's like, I want to test out all of these things to see if, because all of your vitamins mess with everything else. So when you're devoid of something, it's throwing off other systems in your body. It's causing more problems than, just I don't feel good. It's leaching the calcium out of my bones. It's, not protein is important for, I think my protein's okay, but we're going to check it again. Protein is important for you to eat, and, for you to, it runs a lot of different systems in your, it helps with brain function and all kinds of stuff. You have to have fat for brain function. So anyway, he goes, "I'll be back in a minute." So he went out and he got a little stabby thing for your finger, one of the little checkers, blood sugar checker. And my blood sugar came down low. And so he was like, "Okay, well, just give me a few minutes, I'll be right back." So he comes back with a bagel and a Pepsi. And he's like, "I can tell you're from North Carolina from your accent, so I know that you drink Pepsi." And he's like, "I know you call it soda instead of pop." And I'm like, yeah, okay. But you also know I'm a bariatric patient. So he's like, "Well, I just grabbed what we had." He's like, we have soda and, stuff in the little snack area. He's like, "I just grabbed whatever I could get." He's like, "You need to eat something." And so I ate, and then he set me down for like 12 vials of blood. So I went down and got that downstairs, except for the fasting ones. I have some of those that I have to do later because obviously I had eaten something. I hadn't planned on it, but I'd gotten sick. So, yeah, that was my day yesterday. That was some awesome shit. I started packing. I packed away like a whole thing downstairs yesterday. I'm trying to get the gumption to actually do something. I'm so exhausted. I need a shower. I know I need a shower. But just the thought of getting up from here and then going into the bathroom and actually using what little energy I have to take said shower is just... I'm out of spoons. I'm out of spoons today. But I still got shit to do. I've still got 32 days or 31 days until I leave, and I've got to get so much done. And Lord have mercy. What else was I going to tell you guys? I think that's about it, really. Oh, so I was told not to go to the gym until I get my vitamins levels up. They're like, because I'm having low blood pressure, because I'm having low sugar episodes, because there are several different vitamins that we know of already that are out of whack, they don't feel it's safe for me to go to the gym. And honestly, guys, how much I love the gym, I haven't felt well enough to go. And I've known this for the last couple of weeks. I'm like, I don't feel right. Something doesn't feel right. I'm going to end up really hurting myself if I go and push myself to do something my body doesn't want to do. So even though I'm not going to the gym, I'm actually losing weight, which is my muscle probably, which makes me sad. But I'll get back to it. I don't let anything keep me down for long. I just got to figure a way around it. So, yeah, I just got to figure shit around. I got to figure my way around it. That's all I can really do. I don't ever say to myself, I can't do it. I can't do it. I always say to myself, I'm at least going to try to do it. I'm going to try to do it. I don't say I can't because I don't know if I can't. But if I don't try, then how would I know? People give up before they even bother to try. Because, of course, people are scared and people are human and that's how humans interact, but whatever. But the thing is that I do my best to tell myself, you can do it. I know you can do it. We just might have to modify it or make it, in a way that I can actually do it without hurting myself. So, I have been taking short walks at night. Just because it's so hot during the day, I can't manage it, and I'm asleep in the morning because my honey, I'm on Korean time. So in the evening, I've been taking a little stroll here and there, and I'm trying to get Yuki a little more, with more public interaction, because she doesn't go out with me. You know what I'm saying? I haven't needed her to go out with me. So she's not really sociable with anybody. She loves me, but that's about it. And I just don't want, I want her to be able to, be okay in a public setting. Because, I will be at the airport, and I will be, going to be at the airport. I'm going to be on a plane. So I kind of want to get her to the point to where she's a little more comfortable being around people. It is because, I usually never take her out with me. I use her at home as my emotional support animal. At home, just because it was hard to get all the paperwork and everything that I needed. And even then, people are always going to stop you. They're always going to be like, you can't bring that dog in here. And then you have to explain, well, yes, I can because of this. Or sometimes you're not. Sometimes whatever you're doing, you may not be able to bring the dog in there. So you got to read up on the rules yourself. You need to make sure that you know your rights. If it's a service dog, a therapy dog, and, or cat, panda, raccoon, turtle, I don't know. Whatever you happen to have is your animal, amphibian, fish, I don't know, service fish. Service fish. Yeah, that's my next one, service fish. But probably act better than Yuki. Yeah, so you just have to know your rights. You have to know what you're allowed to do, because places can tell you to get out. And they don't, and usually they're not nice about it. They're usually dicks about it, and they're going to tell you to get out. And you have to show them your paperwork, and you have to explain to them. But if your dog is being an asshole, and squirming around and making noise and barking and just being ridiculous, then that dog doesn't need to be out. That is not a calm, collected dog. That is, that's not something you want. That's not an animal that you want to take out in public for you, because then you're taking care of the animal instead of the animal helping and taking care of you, which defeats the entire purpose. Now, Yuki, since I've put her on medication, has become a little different. I still need to tweak it. I think I want to go back to the other stuff. I think the other stuff helped her be a little less Tasmanian devil. So I think I'm going to switch her back to that. And I'm hoping I'm not going to have to give her any more pain meds after September the 7th, which is her last surgery. So hopefully I will not have to give her any more pain meds, that she'll be mostly pain-free, and I'll just have to give her sedatives. Which, it's not really a sedative, guys. It's baby Xanax. It's barely anything Xanax, just to help with her insane amount of anxiety. Well, I can't even say anxiety. She's overprotective. That's what I should say. It's not that she is. It just damn depends. Anywho, I love your beautiful, gorgeous, amazing faces. I hope everyone's having a wonderful day wherever the hell you happen to be in this world. And I will do my damnedest to talk to you guys again very, very, very soon. Mwah. Bye.